Hello guys, how are you? I hope you are all doing good. Today I'm going to talk about the medical equipment found in the maternity. And I'm going to talk about two. There are several of them, but I'm going to talk about two. The first one is the peanut stethoscope and the second one is the photocardiograph. And let's go to the first one, which is the peanut stethoscope. And here we say that peanut stethoscope is a handheld medical device used to listen to the heart rate of the fetus during pregnancy. It is hollow and made of wood or metal, and it is about 8 inches or 200 meters long. Here are some of the photos of the peanut stethoscope. As you can see, these photos are of various designs, and you can choose the design you like. It has even various sizes and various materials are used from it. As we have said earlier, it is either made of wood or metal. Now let's go to the advantages of the peanut stethoscope. The first advantage is that the peanut stethoscope is very simple. Yes, it is something, as you have seen in the photos that I have displayed earlier, something that is very, very simple. The second one is it has low cost. The design of the peanut stethoscope, you have seen it earlier there. You can see that thing is very simple, has low cost. And if it is simple, it means that this thing has low cost. The third one is no maintenance. The fourth one is no running cost. Now let's go to the disadvantages of the peanut stethoscope. The first one is that sound distributed by the outside and other moves from the body. These sounds can interfere with the heart, it can interfere with the nurse when listening to the heartbeat of the fetus. Maybe the nurse will not be able to tell exactly, because this thing is something that is manual. You place it in the belly of the pregnant lady, and then you listen through your ear by the nurse. So the sound from the outside environment, it can interfere with the results. And the second one is that nurse found occupied while listening to the heartbeat. Everybody has his or her own stress, his or her own mental problems, emotional stress, and all that. This can interfere. If the nurse is not ready, or the nurse was having some troubles, this nurse cannot be able to tell exactly the heartbeat of the fetus. As I said earlier, this is something that is manual. The third disadvantage, that it is permanent monitoring. Permanent monitoring is not possible. Yes, because you can. This is because you have to be visiting the clinic, or you have to be visiting the health facility so that you can be monitored. This is not something that can be monitored permanently. Let's go to the second device, and this is photocardiograph. Photocardiography is a diagnostic technique that creates a graphic record or phonocardiogram of the sound and murmurs produced by the contracting heart, including its valves and associated vessels. This photocardiography, first of all, they mostly use the microphones that are placed in the belly, and then a gel is applied on the belly of the pregnant woman, and then they monitor that graphic record now. And here is an example, just a mere example of the graphic design or graphic record that is produced during photocardiography. Let's go to the advantages of the photocardiogram. It is non-invasive. The second one is it is relatively simple. The third one, it is very cheap. And let's go now to the disadvantages of photocardiogram. The first one is that it may be disrupted by the ambient noise and the body movement. When I say the body movement, I mean the contraction of the vessels. When a lady is pregnant, several occasions happens internally inside his body. Movement of the baby inside the belly. There might be contraction of the vessels. The second one is very liable to interference. And the third one is patients are frequently Patients are frequently disturbed during testing. They can be very anxious. You see, and this can result to not producing the correct graphic record that was needed. Existing microphones used in the phonocardiography are bulky and obstructive. These microphones that are placed on the belly of the patient, they can be so bulky and they can make the patient to be anxious or discomfortable. And that is the end of my presentation. Thank you guys for listening to me. See you next time.